The first area we're going to look at is really the issue of attraction. And that is, I want you to think about addiction treatment as a system of care, and we're going to ask this question. To what extent does the current acute care model of addiction treatment voluntarily attract into treatment the people in this culture, individuals and families who suffer from this disorder? I'm going to argue with you that one of the recovery-focused performance requirement is for the treatment of any disorder that system of care should attract people who suffer from that condition and bring them into care. And I'm going to argue that they should attract those individuals at the earliest possible point in the development of that illness. Because what do we know about chronic illnesses? I don't care which one we're talking about. The earlier the point of intervention, what? The better the long-term prognosis we got. Profound differences. Whether we're intervening very early or whether, in fact, I told you the story of the woman we brought into treatment who died 7 months later. She had a 7-month recovery story. Profoundly changed her life, believe it or not. She had a quality of recovery in 7 months that's comparable to people I've seen with 10 to 15 years of recovery. But think about it. Think of the incredible waste that we're intervening with people who are terminally ill, who have months to live, regardless of our best efforts. Whereas if we were to intervene at the earlier possible point, think about the years and richness of recovery that this woman could have lived with her family. So we're going to begin. We're going to ask the question, to what extent do people who meet DSM-4 criteria for abuse or dependence, many of you have heard this figure before, which is in any given year, 10%, 1 out of 10, people who have a substance use disorder in the United States will enter specialty sector addiction treatment. That is all, 1 out of 10. I'm more concerned with another figure. And that figure is how many will actually see that treatment in their lifetime. And consistently that number is less than 25% of people who suffer from alcohol or drug dependence. I'm just talking about now the most severe category. Will see specialized addiction treatment in their lifetime, suggesting that 75% of the people with the worst alcohol and drug problems in this country will not see us. They will not enter this specialty sector. So we're going to ask the question, why? And here's what we find.